Hello and a very warm welcome. We're going to take some time today to talk about something really personal, a topic that so often gets hidden away in silence, and that's painful intimacy. I just want you to know right from the start that this is a safe space. This guide is all about giving you some clarity, some compassion, and most of all, a real sense of hope. So let me ask you this directly. If that question hits home for you, even just a little bit, I really need you to hear me on this. What you are feeling is completely real, it is absolutely valid, and it's something that deserves kind, expert attention. You are so far from being alone in this. And this number, this is why I know you're not alone. Up to 1 in every 5 women, that's 20%, will go through this at some point. Just let that sink in for a second. This is not some rare, unusual problem. It's a common medical experience that affects so many of us. And it is absolutely 100% not a personal failing. Now, we know this goes so much deeper than just the physical pain, right? It comes with this heavy emotional weight. You might feel guilt or fear, or the sense that you're somehow not enough. It's incredibly isolating. And it impacts our partners too. They can feel so confused and helpless. So let's just start by acknowledging that whole struggle together. There's actually a medical name for this, dyspareunia. And I think just giving it a name is a huge first step because it helps us see it for what it is. This is not a judgment on your relationship or on you. It's a medical symptom, plain and simple, like a migraine or a sore back. And just like any other symptom, it has causes and, thank goodness, it has solutions. I think this slide shows it perfectly. It's like two sides of the same coin. Over here, you've got these very real physical reasons for the pain, things like hormonal changes or conditions like endometriosis. And then over here, you have the huge emotional fallout, the fear, the guilt. It can create this really tough cycle of anxiety for both of you. And both sides need that gentle, compassionate care. Oh, please, if you take away one thing, let it be this. Your body isn't rejecting your partner. It's not saying you don't feel desire or love. It's just sending a signal. Think of it like a smoke alarm going off. It's a clear message that something needs attention. It's your body's way of asking for help. Okay, so where do we go from here? How can we start to heal and find that connection again? Well, this next part is all about practical tools. These are things that you and your partner can start using right now to begin rebuilding that beautiful bridge of trust and intimacy, one small, gentle step at a time. This is a wonderfully simple but, honestly, life-changing tool. It's called the traffic light system. And it's not just about stop and go. The real magic here is that amber light. It creates this safe space to just say, hang on, let's slow down a bit and check in, without having to bring everything to a halt. It puts you back in the driver's seat, and that feeling of control is so crucial for rebuilding trust. I absolutely love this idea, the sexual menu. So often when penetration is painful, all intimacy can just stop because of that fear of where things might end up. This completely changes that. You sit down together and create a menu of all the lovely, pleasurable things that don't cause pain. And you agree beforehand that you're only going to order from that menu. Suddenly all that pressure is gone. It gives you both the freedom to just relax and enjoy each other again. I really need to say this as clearly as I can. This idea that we should just push through the pain, it's not just wrong, it's actually harmful. When you do that, you teach your body and your brain to associate intimacy with fear, which can make the muscle tension and the anxiety so much worse. That signal your body is sending is a wise one. Please listen to it. And listening to your body often means finding the right person to help you understand what it's saying. You need a guide you can trust on this journey. And here at the Women's Health Clinic, that expert guidance comes from specialists like Dr. Farzana, who has truly dedicated her entire career to women's wellness. You can see that Dr. Farzana brings just an incredible depth of experience to her work. We're talking over 2 decades in medicine. Her background in both gynecology and sexual health gives her this amazing, holistic view of what's going on. And the fact that she now trains other doctors, that really tells you everything about her level of expertise and how committed she is to the highest standard of care. And this right here is her whole philosophy. It's all about working with you as a partner. This isn't about someone in a white coat just telling you what to do. It's about you understanding your body, knowing all of your options, and then making decisions together, as a team. It's care that is centered completely around you. So let's take a look at what that path to feeling better can actually involve. This is the hopeful part. This is all about getting to the root cause of the pain and then using proven, effective medical strategies to help you heal. There is so much that can be done. A specialist like Dr. Farzana has a whole toolkit of options to explore with you. It's not a one-size-fits-all solution. It might be something like topical estrogen to help with tissue health, or working with a special physiotherapist to gently release tension in the pelvic floor. It might also mean therapy to help break that fear-pain cycle. The beautiful thing is that the approach is holistic. It looks after both your body and your mind because we know how deeply they're connected. Okay, and this is so important to touch on. While a specialist can help with ongoing issues, there are some times when you really need to get checked out urgently. If you ever experience any of these red flag symptoms, things like sudden, really bad pain or any unusual bleeding, please make an appointment with your GP right away. This is just to make sure we rule out anything that needs immediate care and keep you safe. I really want to leave you with this thought. I know what you're going through is hard, but please know that it does not have to be your story forever. You absolutely deserve to feel comfortable and happy and at home in your own body. You deserve to have connection without being afraid. Healing is not just a vague hope. It is truly, genuinely possible. And the very first step is knowing that you don't have to figure this all out on your own.